Hi everyone, thank you for attending the July Partnership Engagement Forum. As you would have been aware, you would have received communications from ourselves and the ICB in regards to communications around our funding situation. So just before we kick off into the hub stats, I just want to let you know that recent communications conversations have taken place, and unfortunately we can't find a alternative funding stream for the hub, which means the hub will look to cease on 31st of March next year. And we'll touch base about this later on as well. But in terms of numbers across the board, so essentially the average case for staff reaching out is still at 52 cases per month. And as you can see on your screens, the June number is a lot lower than other months. This is because we stopped taking one-to-one direct referrals on the 26th of June. So the last numbers to come through to the hub are 66 cases, and in total we have had 1,911. As you can see on screen, there have been different instances, different months where we have surpassed 100 cases per month. And these are highlighted in yellow with a few close to getting to 100. This information is accumulative information from the start of the creation of the hub up until June last year. So as we go forward in terms of organisational numbers and a cumulative approach, the top five again are Merseycare on 302. Sorry, no, that's not Merseycare. That is Liverpool University Hospitals on 302. Merseycare on 294. St Helens and Knowsley on 115. Countess of Chester on 101, and Mid Cheshire Hospitals as well on 100. And then we've also broken it down and included PCN stats. But if your organisation is not on here, this is because it's below our 10 quartile, if you would, purely because it's personal identifiable information. So I can share with you and I can give you breakdowns. Your HR directors should have received data insights as well as service usage from your organisation. So as we look further in terms of referrals for June, again, we can't share anything under 5 purely because it's confidential aspects of personal identifiable information. But the trust information that we do have is for Merseycare, they had 14 in June, and Liverpool University Hospitals had 11. There were other instances, however, people have not shared information with us. So we have 5 NHS trusts, we don't know where they are. And then there are also missing categories that people have just declined to fill that information in, and that was 4. So as we look in terms of numbers, approaches, and job roles, qualified and training midwives and nurses are on 21. And again, this is just for June. Nurses, NHS healthcare assistants are on 9. Qualified or trainee doctors and consultants are on 8. Both non-clinical support role and trainee qualified AHPs are on 7. Other is 5. Trainee and qualified social workers are 4. Non-clinical managers or senior leaders and also the missing category are on 2. And clinical allied healthcare professionals managers are on 1. So that's a bit of an insight as to our numbers for June. And like as usual, we also give you insights when we pass information to. So we have referred outwards 11 nurses and midwives, 3 doctors and consultants, 1 manager or lead, 10 other clinical positions, 4 non-clinical positions, and this is because we can't provide the right support in-house, so we've gone to our local partners who will pick these cases up. In terms of a pathway non-clinical support aspect, we've dealt with 9 different cases this month, and that is around housing, finance, debt, social engagement, etc. We currently still have 3 people awaiting one-to-one assessments, and this will be complete in the next week. and we have 11 people waiting on group assessments. Although we have stopped taking one-to-one referrals, for psychological interventions, we do have the group open, so people can refer into the group itself. So that brings us to hub updates. Not recording.
Lee, just before we go to the partner updates, and I won't take too much of the time up for that because I think I speak quite a lot. I think we just need to acknowledge that this is going to create a massive deficit in terms of that regional offer and support. And just to kind of shine light on the fact, or ask the question of everybody on the call, what's everyone going to do? What local plans do we have in place to support the absence of this service? I know that we certainly are looking at how many clients we saw from the hub. We've worked out within Merseycare that it's the equivalent to full-time equivalent of a CBT therapist, and we're looking at ways and business cases now to be able to fund this. But I suppose from my perspective, I don't want to be looking at this in isolation, because it's really apparent that we're all going to be in a similar position. And if I'm missing a trick, or our approach isn't the right one, I'm really keen and interested just to hear what everybody else might be doing, because there's going to be a lot of knowledge and I'm going to say expertise around this table. So I suppose my question before we go into the partner updates is to everybody, just to understand, what are people's plans basically.
I will open that to the floor if anybody has any insights.
Oh.
I know from conversations from myself, for example, with the Northwest team and the ICB, there is some sort of, there should be contingency plans in place. For example, once we've gone, what is the ICB going to be doing to help support this? And this will be conversations which we will be having, and I can share this information with you. But again, what we've recognised as the team is that if, for example, we just go, what's going to happen? Because we are part of Merseycare, but we're not Merseycare, if that makes sense. So Ben's got his own team of health and wellbeing things, and that impact there is going to massively drive the need for Ben's team tenfold, if you would.
Yeah.
So it's that aspect from well, your point of view, if you would. What is it that you're doing? Jude, you've got your hand up.
Yeah, I put my hand up. Obviously, I'm not part of an organisation, so I can't directly answer your question, Ben. However, just linking, when I linked in with Lancashire and South Cumbria, and obviously their mental health hub has already ceased to exist. But what they are doing and looking at, trying to do, is to not replace, but to look at where they can build capacity elsewhere, is working with the focus on the growing occupational health and wellbeing strategy work that they are bringing into their system and the organisation, and looking at how they can cover some of that demand through the additional resources, and potentially linking wellbeing and occupational health together as one, and therefore incorporating some of the demands that would have otherwise gone to their hubs. Obviously, it's not in position, so it's not replacing, because one's gone and one still isn't, at that space right now. But that is how they are looking to fill that void moving forward.
Alison? Yeah.
Just taking myself off mute. I forgot how to do it for a moment then. Isn't that weird? So, and again, I'm not, my name's Alison, and I work for Skills for Care. So we support a lot of social care, adult social care providers. So slightly different slant again. And the great thing about the Wellbeing Hub was that it was opened up to social care colleagues. And as you know, social care is made up of multiple providers. So some big providers with their own occupational health provision, and some very, very small providers who literally have nothing. So even though they might not have used it massively, I know people did use it, and it was good for people to know it was there. And in terms of what people are going to do about it, I honestly don't think people know what they're going to do because of the nature of the social care sector. We have, and our role, I guess, is just to signpost people to where they can get support around wellbeing. So we have like a wellbeing resource finder where people can go on and look at what's available and what they can access. So I guess if there is anything that people can think of, then we'll put that on our website and direct people to it. But we don't have a big budget for anything to do with wellbeing. So it worries me, to be honest, because we haven't got you guys and your services to signpost people to. So yeah.
I'd absolutely echo that, and I think we look at this, and they said after COVID there's going to be like a veteran model of care where it could be anything from 7 to 13 years afterwards that staff or people that were exposed to it still need support. I think as well, in addition to that, you need to pair this with the idea that we're going into financial crisis, we're going back into winter pressures. I'm going to say the majority of organisations are going through massive scale organisational change. I'm doing a diagnostic with the organisation at the moment. I'm recognising that around 50% of our staff within the last 12 months have said they feel either stressed often or all of the time, and we're only going to be seeing an increase in this space. So again, it doesn't solve the issue. What it does is it just really shines a light on the scale of the issue and how much we need a service like this, or certainly to reinvest somewhere else to make sure that we're picking and holding these people up.
There's that's exactly it, Ben. I think I'm just also trying to do two things at once here, because we, as a hub, we have, for example, a 360 with Manchester. So where do the strongest go when they need help, type of thing. So we had a 360 with Manchester, and that's still in place. But there's also things like practitioner health. I'm just trying to get the details up. Now, practitioner health is free and confidential. It's very much like us, but originally they was focused on, say, doctors, for example.
Yeah.
And then Bernie's just put something in the chat there saying there's stuff like Maximus Access, and they refer staff to them as well. This is what we're trying to gauge at the moment, is trying to put the feelers out to understand our partners, because a lot of, for example, the staff phone line, NHS and social care staff phone line got taken out, and then became that text line. So we're trying to find organisations what are they're currently accepting referrals, because there's a lot of we can only accept this, like Burgess just said, they only usually accept referrals from doctors or practitioner health type of thing. So, but it's useful to know. So we're trying to pull up.
We're nearly robbing Peter to pay Paul, aren't we? And again, it's getting political this now, Leah, and you know how I feel about certain things, but we're taking money out of one service and putting into another, because at the moment, I'm going to say some of them services that you're talking about, we know that they're already at capacity. We start redirecting staff to there, all of a sudden we're bottlenecking into these services, and therefore they need more investment. Now, why can't we just put the investment or leave it where it is?
I think I'm going to tell you something that I don't know whether I can tell you. Well, actually, yeah, because it's coming in an
love
email.
you. Spill, go on.
So part of the BPS campaign, one of our staff members emailed their MP, and from that, the MP is over in Wirral, and bear with, and they then went to Will Quince, who's a Secretary of State, and come back, and let me just grab this. Sorry, it's not how I usually do meetings, but spilling the tea, so I might as well share it with you. I'm just going to share my screen with you again. So this email come through. So this was a response from Will Quince, and within this email, it mentions that NHS England has committed to a regional rollout of one or more mental health hubs per region during 23-24. This will ensure access to clinical psychologists, assistant psychologists and support staff, and ensure suitable administrative support for managing caseloads and supporting outreach to identify staff in need of support. So I got this from our staff member. This has come from Will Quince, MP, Minister of State, and also from the MP Margaret Greenwood, who is the MP for Wirral West. So this come from our staff member, and I've obviously been nosy and chased it up. It, like you just said there, Ben, it's robbing Peter to give to Paul, and the idea of taking us out, but then what everybody else is going to do, and even people in the hierarchy within our service, the senior responsible officer, didn't even know about that sort of information. So the information that is being shared isn't being shared widely enough, if you would.
No.
So, and I understand that it's probably GM leading something like this, but the messages aren't the same across the board.
No.
And I only found that out by chance because I'm nosy. So it's that sort of aspect there. If the people at the top aren't being told about it,
Yeah.
Jude, I'm going to come to
I
you,
know
Jude.
Joanne's
Yeah, sorry.
got a hand up, but this is just relevant to what you're saying. So that regional hub, so the funding that you mentioned before,
Yeah,
that the national team the found, and it's a little bit, isn't it? So it's going to be about 105,000 for Cheshire and Merseyside. But that funding was envisaged that a regional hub would be set up with that funding. The funding is non-recurrent, so basically by the time any sort of hub might have been set up, there then wasn't any funding to kind of keep it going. So the conversations were had within Northwest region by I think chief people officers and others, and the decision was made that actually in Northwest we wouldn't be putting together a regional hub. The money instead would be split between 3 systems, and then they would use that accordingly to kind of
makes sense.
keep going to. So there isn't in the Midlands, I think they are looking at a regional hub, but it's the only one that I kind of know of at the moment. But yeah, you've not missed anything. It's not.
No, that's it's just like I said, that email come through, and it was kind of, well, why am I getting told this, and the people above me aren't. Thanks, Jude. Appreciate that. Joanne, I'm going to come to you.
Yeah, I've got to go, I'm afraid, because I can only say, but it's all right. I'm here on behalf of Chloe Hurd, who usually attends. So I'm from the staff support service at Luff.
Yeah.
To be honest, I think part of what we're doing is just waiting and seeing how it impacts on referrals. I don't think we've seen an increase yet, but I wouldn't be surprised if we did. We do also have a wider sort of wellbeing strategy. I know Chloe and our wellbeing manager go across the trust and do wellbeing days, and we've got wellbeing timetables and things like that. But I think, yeah, we're just keeping an eye on our referrals here really and seeing how it goes. I think that's all we can do. I think we were trying to recruit somebody else into post, but I don't think the funding's there for it at the moment. So I think we're a small service. I think we've got the equivalent of, I think, 1 full-time psychologist, an assistant, and I mean, surprisingly, the waiting list isn't that long, but I don't think it will stay that way.
Yeah,
because you're one of the biggest users for the hub as well, aren't you, Joanne? Yeah, okay.
Yeah.
Interesting. And it's that swings and roundabouts thing what Ben was saying before as well about looking into recruiting, say, a full-time equivalent therapist to manage the waiting list. And as we start to go into the winter periods, we know this is going to be a lot bigger and a lot stronger, if you would. Thanks, Joanne. Thanks for popping by.
Yeah, thank you. Bye.
Bernie's also mentioned in the chat, it's not direct one-to-one, but there's lots of free support apps available, such as Unmind and Headspace. Again, all this is available on our website. There's an app tracker, so you can specifically put stuff in, and I'll send that in the minutes as well. But I've also invited Jeanette, who is in the green, who is her name is info on the chat. Jeanette is from the Manchester Stress Institute and does offer a range of things like beat the burnout courses as well. So Jeanette, we'll come to you in a bit if that's okay, once we've just done partner updates, and I'll let you tell everybody about you and your service.
Yeah, perfect.
Brill, thank you. Smashing. Does anybody else want to raise anything before we go on to partner updates? No, brill. Okay, right. Ben, I'm going to start with you.
Dead quick then. Key things at the moment: we're doing some targeted intervention with all of our teams that who exceed the current sickness absence rate. And that's not about kind of saying that our sole focus needs to be sickness absence, but it's about making sure that everyone's fully sighted on what our wellbeing offer and how we can start offering that proactive support. Currently undertaking as well a health and wellbeing diagnostic, which has been very, very, very interesting reading. I've had about 800 responses to date. Massive concerns around the amount of staff who were struggling from MSK related ailments in the last 12 months. Massive increase in staff who I identify as having a diagnosed chronic ill health condition. Massive concerns around the amount of staff who are identifying as having stress, anxiety and other emotional diagnosed disorders. And we're really shining a light on things that we haven't been able to kind of evidence before, which is really interesting. So I'm hopefully doing a report on that in September, which should be going to People Committee with a set of recommendations which will inform the new strategy. Anything else from me? No, that's it. I'm not going to go on forever, but it's just it's about, at the moment, it's about diagnostic, it's about formulation of plan, informing a strategy, and then basically underpinning it all with an action plan to say this is our 3-year approach, this is what we're going to commit to.
Brill. Thanks, Ben. When I read it all, it sounds really interesting from the communications point of view. And it just gets me thinking, you've got so much going on, you need a bit of time to breathe as well.
Yeah. I've got to hold you again soon.
Oh, that's all right for some, isn't it? Bernie, I will come to you because you are now a new service, aren't you?
We are. We have merged with Southport and Ormskirk, so we're now called Mersey and West Lancashire Teaching Hospital Trust. And we're very lucky in our team as STHK. We have our own wellbeing team, wellbeing service. So we run a lot of sessions ourselves, and obviously we tap into yourself as well for resources and support. So coming up for us, we've got a whole programme of sessions running right through to December on monthly mindfulness, stress and stressors, CBT skills, sleep hygiene, self-care. One of our psychologists is doing sessions around acceptance and commitment therapy, ACT. We've also got a 12-week fitness programme coming up, which staff can join in person in one of our gyms, or they can join it online as well. We've just run 12 weeks of that, and that was really good. That starts again in September. We support staff suffering from SAD every year. So we've got, again, running from August right through to March, we've got monthly topics and sessions to support SAD, linking with our international students as well, because we found that a lot of nurses coming over from India were just floored by SAD and had no idea, because they're just not used to the change in daylight hours. So we're really targeting the international students with that as well this year. We run weekly Mindful Monday, Thursday, and Chair Yoga on a Friday online, and we've set up some sessions working with the colleagues from Rugby League Cares to do some building resilience through change, because obviously the merger and the changes is going to have a huge impact on lots of different, all of us, because we're all merging with equivalent teams, and as we know, change is difficult for some, isn't it? So we're looking at how we can support our staff with change as well. Menopause Network, we've got stuff going on up until October, Menopause Day, and suicide prevention in September. So we'll be putting on sessions around suicide prevention. And again, we're linking with Money and Pension Service for Talk Money Week, which we linked with yourself, Lee, last year to share our links. We've set up the meeting for that, so I'll pop the link for that in the chat, because that's open to any trust in the Northwest can join with us on that.
Brilliant.
From us.
Thanks, Bernie. What's in terms of your merger, in terms of mental health, so Southport and Ormskirk and St Helens and Knowsley, is it just going to be one wellbeing team going forward, or are you going to have?
We're merging with the occupational health team, so they don't have a specific wellbeing team. They it's all done within occupational health. So
okay.
So we'll be one team.
Okay, I'll touch base with you later on about just to get a bit of insight, because I've put together a bit of a presentation where people can get internal support and stuff. So I just want to make sure I've got it right for you guys and not cross-confusing stuff. Brill. Thanks, Bernie. We do have two newbies joining us on the call. We have Ruth and we also have Gareth as well. I'm not going to come to you guys for a update because this is your first meeting. But welcome to the Partnership Engagement Forum. It's where we share best practice and lots of different insights as well. Alison, over in social care, come to you.
Yeah, I was hoping you wouldn't really, because I don't really. I mean, it's so difficult, like I said before, because we kind of support the social care sector, but we don't have other than signposting and supporting people by default. We, what Skills for Care does isn't really relevant to this group. But I guess I assume it's mainly health colleagues. But what we do, as you know, Lee, is we do run network meetings with the social care sector, so with register managers and different roles across the sector, really. So if there's anything anybody ever wants to get out there into social care, then we're more than happy to welcome people to one of those network meetings or to share information via our networks, really. But like I said before, it's so mixed what's going on out there,
I will touch
Probably
base
not
with you
helpful.
after and I'll share your information specifically within our newsletter for social care contacts as well.
Thanks, Lee.
No worries. Sophie in Mid Cheshire, I'll come to you.
Hi. Not really a lot going on like currently, but our social prescribers model's just been approved in the last couple of weeks, and so we're looking to launch this next year. But we know that East Cheshire Trust, our trust nearest to us, is also looking to launch the same sort of model. So we're just working with them to make sure we're not overlapping any of the work and making sure we work collaboratively. This is really good for our service because it would mean that we're a team of 4 instead of 2, because currently at Mid Cheshire there's only 2 people in the wellbeing team, so there would be 4. I also think with the changes with the hub ceasing to exist next year, this service will be really good for us with signposting to other resources. What else? Through our EAP, like our employee programme, we've now got a counsellor that's on site 1 day a week, which offers one-to-one counselling and CBT counselling. We've also brought on a mental health practitioner as well. And I guess the only other thing would be, as usual, over the last 6 to 8 months, cost of living. We've been doing a lot of cost of living sort of sessions, and we've also just brought out a new cost of living leaflet, a 28-page leaflet. But yeah, and all of the resources, we have kind of used your resources as well. So thank you for everything that you've put out with cost of living. But yeah, that's a quick update.
No worries. Thank you very much. Really appreciate that. It's like I said, everyone's got everything going on at different times and whatnot. And what we're trying to do is bring everything together under one aspect, sharing best practice, if you would. Bernie's just said in the chat, they'd love to know more about your social prescribing model. Am I okay to share your details with Bernie?
Yeah, that's fine, no problem.
Perfect. Thank you. Jude, do you have an update from the Northwest? I know it's really the Northwest wide, but if you've got a small update, I'll include you.
Yes, yeah, I can give something. So yeah, I suppose so you may or may not be aware that NHS England are going through rather a lot of change at the moment. We in the Northwest region have just come to the end of our consultation process. So we're waiting now on final structures. So, but the one thing that's guaranteed is there will be less of us. And the national team, they are currently going through their filling of posts, and they have been somewhat cut as well. So not rosy news, but anyway, that's the case in the region. And kind of as a result of that, I suppose we are looking at our kind of key priorities moving forward. We have a growing occupational health and wellbeing steering group, which meets every 8 weeks, and representation from the Cheshire and Merseyside include Linda Lewis, Diane Haydock and Paul Martin. And again, we're just currently reviewing the priorities that the region will focus on to avoid the 3 systems doing 3 pieces of work that are very similar. Let's do it all together as one region. And things like that include kind of looking at some sort of line manager training of when to use, when not to use occupational health services. We're also looking at career pathways and roles within occupational health as well, and looking at the apprenticeship offer. So doing some work around that. Our newsletter is due out next week, so hopefully it'll land in your inboxes, but just key things that covers. NHS employers, actually, we've talked a bit, or people have talked a bit about cost of living and stuff. They have an event on the 9th of August, so there'll be a link on that you may want to attend and see if there's anything else you could add into any of the tools and resources that you provide. There is some the post-pension guidance around suicide was launched this week on Tuesday, I think it was. So there'll be some links to the documents and tools on our newsletter from that. We are holding our next community practice in September, and the theme, it's based on the People Promise themes, and the theme in September is We Are Recognised and Rewarded. So we'll be having a couple of case studies shared and presented at that related to that theme. Also, think about the violence prevention work stream. The national team are currently reviewing the violence prevention standard, and they're looking for people to interested that will help to review that standard. So they're putting on a bit of a workshop. So I may be sharing some of the dates for that if anybody knows of anybody that would be welcome to or would want to get involved with that. They also have a form to register for interest in an accredited qualification around level 3 and level 4 qualifications around violence prevention and reduction, which are more the basic level qualifications. So there's 150 places nationally for that training. So I will be promoting it a bit more once it's in there, but that's October, November time, and they're kind of going to be happening.
I'll share that info as well for you in our newsletter. I'll wait for your newsletter and just grab the stuff as well from there to link your newsletter to ours as well.
Yeah, no, brilliant. Hopefully Monday you'll get it.
Yeah, cracking. Thanks, Jude.
No problem.
Brill. So just conscious of time, I'm just going to pass over to Jeanette, like I said, who's from the Manchester Sleep Foundation, isn't it? Institute. Manchester Stress Institute, not sleep. Jeanette's got lots of stuff happening within her area, and it might be beneficial for some of you guys. I did invite her to come over and give a bit of a chat to you. Over to you, Jeanette.
Thanks, Lee. Hi, everybody. Great to see you all today. So really interesting listening to you all around some of the challenges that may occur due to the expiring of the Cheshire Merseyside Resilience Hub. We are the Manchester Stress Institute. We are an external support organisation for the NHS for emergency services. We've been established 15 years or more. And we provide a whole range of different interventions for staff working in emergency services and the NHS. Bernie, I didn't realise that Bernie was going to be on this call, but Bernie has been on our Beat the Burnout programme, so I don't know if she's got anything to say about that, but we present a programme called Beat the Burnout. Am I able to share my screen so I can just, there she goes.
Yeah, you should be able to share your screen.
Is everybody okay if I share my screen just to show you? We're currently at the moment working with the police, fire and ambulance and NHS on a blue light programme. So I'll share my screen and I'll show you a few pages of that just so that you can get an idea. Oh, sorry, that's you. Just so that you can get an idea of some of the programmes that we actually do. So here is the brochure. You can all see that okay? Can you see that? Somebody say yes, no?
Yeah.
Yes.
Yeah. Right, so this is a blue light. So just really kind of tipping on some of the things that you talked about. Ben, I know you was talking about where do we signpost staff when they are burnt out? You know, you mentioned stress, you mentioned depression. You know, and what we see a lot, most certainly for staff that work in the NHS, is shift work exhaustion, just exhausted. So this programme is fantastic for giving staff resources to enable them to sleep better and recover better. We do a brilliant 999 sign language programme for staff that work, you know, that want to be better able to communicate with deaf or hard of hearing people. But the burnout programme really, I guess, is one of our kind of foremost programmes, helping people to recover from burnout. We also do a great Leading Well programme. This is aimed at senior executive teams and you know, looking at how they lead their own well-being in terms of modelling, but also leading well in terms of you know, staff taking care of themselves. Adult mental health, which I'm sure you've got, shift work, sleep, mental health and well-being. So a whole range. There's many more. I won't bore you with all of them. But just to say that I've dragged a few bits up here. So we've just finished a fantastic programme with Cheshire Merseyside Partnership. These are just some little videos of some of the people that work in your social care support teams, people that work in the senior leadership teams. I'll just press a few buttons just to give you a smidgen of feedback.
So for me, the burnout programme has been life-changing. So I came into this programme.
That lady's senior executive director, and she started on the programme in tears because she was under so much pressure.
4 weeks has just absolutely been life-changing.
Everything just literally life-changing, and I just wait for a few more to start.
So being the burnout for me has been like outstanding, I feel.
So that's just Cheshire Merseyside Partnership. We just finished with St Helens Care, which is what Bernie was on. NHS, lots and lots with NHS. Again, different one for Cheshire Merseyside. So the only reason I'm pointing these out, and I'll just stop the share now, is because for me, one of the the most successful strategic workforce wellbeing programs is where the information and the communication is joined up. And I've just heard what Lee was saying about Headspace and different apps and different this and different that. And what we've found, having been established for decades, is the more cohesive the wellbeing message, the more successful and more powerful it is. There's a language to well-being. There's no doubt a well-being to language to well-being. And many of you many of the staff that you have within your workforce will live within that community. You may even have, you know, a partner, a husband and wife, a wife and wife, a husband and husband that work within your organisation. And that language also transports to how they communicate well-being at home as well. So that all of that matters to us, that the dialogue around well-being is understood and embedded at a workforce level. So that's all I'm saying from our side. We have clinical psychologists, psychotherapists, just a whole range of experts. I am a biochemist and a sports scientist, so my expertise is how stress and extraneous factors impact the mental, emotional and well-being. So if you are looking for support, most certainly through September through to January for this autumn winter period, we would love to have a talk with you. If you're looking to develop a 3-year strategy, most certainly we can help with that as well. We do the wellbeing for the BBC, so we're really strong on digital wellbeing. And also as well, I would also say, I just heard Bernie talking about one of the psychologists there is doing a program for them. In your organisations, you will have experts. Even if they're not classified and maybe qualified as an expert, but you'll have people who do big mudders, who do 10Ks, who do marathons. Let's bring them out of your organisation and give them the opportunity to inspire your staff, their colleagues, in towards wellbeing, and we can do that digitally for you. So we'll bring them onto the screen and do podcasts and webinars and all sorts of stuff. So it's not a sales pitch, this. Lee didn't bring me on here to do a sales pitch. We're busy. We're busy. But because we work already with many of the organisations around Cheshire Merseyside, we were just showcasing some of the work we've done for them, and that we may be able to help and you know, provide support to your staff and the consultants as well.
Yeah. Ben has commented in the chat and said, how long is Beat the Burnout programme? Because one of the biggest issues NHS trusts are experiencing is that releasing staff to attend as commitment conflicts with operational procedures.
Great,
pressure,
brilliant question. Thanks, Ben. So we have two options for Beat the Burnout. First and foremost, the primary one, it's a 4-week programme, and during that 4-week programme, the staff have 4 45-minute one-to-one sessions. So 4 45 minutes, so that's about 3 hours and 3/4 over a 4-week period of private one-to-one coaching sessions. So that's that one. And then we also have an online Beat the Burnout, and that can go to obviously the masses. So on that one, that is again, I think it's a 3-week program, but staff do it at their own time, at their own leisure, because it's online.
Great, thank you. Yes.
Thank you. What I'll do tonight is I'll share your information, a website and whatnot within the minutes. Am I okay to share your email address as well?
Yes, please do.
Yeah. Okay, brilliant. Thank you very much. We've got 4 minutes left. Does anybody have any queries, questions, burning desires? Speak now or forever hold your peace. Silence. I love it. Well, thanks, guys. It's been emotional. I will get all these typed up, sent out, and the video edited to you all by next week. If there is something you do want to include in our newsletter or within our socials within the next month, do let me know as well, because I'm on that next week. Thank you all for joining. I know some of the information wasn't the information that we'd love to hear. But needs must. Have yourself a lovely weekend when it comes round, and I'll keep you updated about what is happening with this meeting going forward as well.